This is me, 6 years old, standing in my living room, wearing my mother's apron and stethoscope. The next day, I was going to make the biggest announcement of my life, at least for a kindergartner. When I grow up, I want to be a doctor. Are you sure? My mother asked. And I was. At that age, I hadn't seen much of the world, but I had this conviction, and I knew deep down that I wanted to help people have hope for a better tomorrow. I was inspired by a docuseries where I watched doctors treat patients from across the world. What stood out to me was that while patients healed, they had this renewed outlook on life. And it wasn't just the patients that got better, but their families as well. And I knew in that moment that there was no other profession that could give me as much joy. So 6-year-old me was committed. Neither my mother's towering pile of medical textbooks, and trust me, there are a lot, neither the barrage of exams could deter me. Not even the threat of a lack of social life. Because who even needs a social life when you have the companionship of novels, right? As I grew up, I saw more of the world, and my appetite for reading and quest for knowledge was what my school teachers loved to call voracious. Because my dream was no longer limited to just becoming a doctor. It grew to wanting to help heal the world. So in the 10th grade, I decided that I want to become a plastic surgeon, that I want to help survivors of acid attacks and children born with congenital anomalies to lead beautiful and dignified lives. And by the 11th grade, I decided that one day I'm going to work for the World Health Organization, or Médecins Sans Frontières, Doctors Without Borders. My intent was set, my path was clear, and I truly believed that nothing could shake my determination. So, from playing surgeon with my uncle, until my maternal grandfather chased us down for using all his handkerchiefs, to staying up late night, studying hard, solving 300 to 400 MCQs, until one day in 2018, my father said, "Harshita, you did it! You're All India rank 783. You're going to Bangalore Medical College." That day, my happiness was contagious. It was truly the best gift for my father's 50th birthday. And I felt invincible. Now, many have called me an overachiever. They've said that I'm multi-talented. But this wasn't just ambition. Studying wasn't just about grades. For me, it was about my ticket to freedom. Here's a confession, my deepest and darkest secret. As a child, I carried wounds that no child ever should. The kind that is invisible to the eye, but seared into the flesh and mind. For the crime of being born a female, I was told I was worthless, that I'll never amount to anything. So in the pursuit of love and approval, I pushed myself. Because even at the age of 8, I knew that limitations meant being caged, and that was not an option for me. I grew up angry at the world, at the cards I had been dealt. I could not understand how someone could mistake cruelty for power. I didn't understand what I could have possibly done wrong that warranted such pain. But in that brokenness, all I wanted was for someone to say that my life was worth saving, to see me as someone unique and know that I'm precious. And I thought that medical school would give me that, because for all my life when I thought of doctors, I thought of healers. And when that illusion was shattered, I felt broken, powerless, and invisible. Life at that moment felt like a job interview that came completely out of syllabus. If you're sitting in this room today carrying your own invisible bruises, if you have ever been told that you are not good enough, if you have ever felt invisible, unseen, unheard, or broken, and statistics tell me that 1 in 4 of you have, I want you to know something. This talk isn't about what happened to us. It's about what happens next. It's about how we become the healers, the change makers the world desperately needs. Because a change maker isn't a superhero. It's someone who's unafraid of the jagged edges. A change maker is a visionary, someone who dares to see the broken parts as beautiful and worth saving. It took time for me to heal my broken parts, and healing to me did not come in a straight line. It wasn't even a neat staircase upwards. It was more like an optical illusions, moments collapsing, shifting, and reforming. My pain transforming into purpose with each change in my perspective. I want you to think about your own life, the good and the bad, the beautiful and the ugly, each and every aspect of what makes you, you. Now imagine them as beads, the memories you've made, the lessons you've learned, the people you've met, the places you've visited, the things you've experienced, the emotions that you have felt, the senses you have engaged. Do you think you can form a pattern with these beads? A stripe, a couple of spirals, a string. What about a checkerboard, some jewelry, plants or animals if you're able to picture it? Did you realize that all these patterns come from things you've already been exposed to? But what if I told you that these beads have the potential, the ability to create endless such patterns and have infinite possibilities, each more distinct and beautiful than the previous? And all it simply requires is a new perspective. For me, this came from my best friend's artistic vision. Our collaboration brought together all of my intersecting identities into a beautiful, ever-changing pattern. So here's a physics pun for all my science lovers. All you need is total internal reflection and your cluster of beads to create your own kaleidoscope. Because isn't life just like a kaleidoscope, light shining through our shards of glass? And aren't we all just walking kaleidoscopes? And if we're all just walking kaleidoscopes, then doesn't that mean that our systems and thus the world around us are as well? Think of the world we live in today. All the fractures, the political divides, wars, burnout, loneliness so thick that it fills rooms louder than any voice. Think of the many faces of inequities, economic disparities that limit opportunity, discrimination based on gender, age, ability, caste, ethnicity, lack of access to essential services like healthcare and education, environmental injustices that weigh heavily on populations already marginalized. All those inequities, those fractures, might feel like shards of glass. But here's the beauty about shards of glass. Inside a kaleidoscope, they don't just cut you, they create beauty. And that's when I realized a change maker isn't someone who controls the pieces of the world. It's someone who keeps turning the kaleidoscope. Because each small twist of the lens transforms sharp edges into patterns of possibility. Each shift in your perspective reveals something once invisible. Each pattern exists not only in people, but in the very systems shaping our everyday lives. Take climate change, for example. The beads in this kaleidoscope are our economies, our choices, our histories, colonization that dictated where industries were built, loopholes in agreements that allow pollution to continue. And yet, those who've contributed the least are the most impacted. What about healthcare? The beads could be healthcare providers, medicine, innovation, research. And yet, millions can't afford basic, essential, life-saving healthcare services, and technology continues to leave millions behind. Individually, these pieces may look fragmented, chaotic even. But when you rotate the lens and look intentionally, you begin to see the connections, the intersections, and how you cannot have justice in one system without the other. You begin to see how no single bead tells the whole story and how solutions must include all of them together. And slowly, patterns of possibility emerge. Because life, like that tube of glass, is made of both shards and beads. And it's not the pieces that change. It's the angle you view them from and the way the light hits them. So what if healing isn't about fixing what's broken, but reframing how we see it? Because the truth is, healing doesn't always mean putting back the pieces where they once were. Sometimes it means learning to look through a new lens. Psychologists call this cognitive reappraisal. Spiritual teachers call it perspective. Survivors call it growth. And us changemakers, we call it possibility. For far too long, we have been trying to fix broken systems with broken tools, approaching problems like they're puzzles, like if we find the missing piece, then all will be well. But just maybe, like the kaleidoscope, the pieces were never meant to fit back together the way they once did. Maybe the work of a changemaker is not to restore the old image, but to rotate the lens and discover new ones, to help people see beauty in new configurations, to show a divided community that their diversity is essential in co-creating new patterns of possibility, to remind us that inclusion should be the norm and that intersectionality is the pattern itself. So what does this mean for people like me, the people who refuse to accept that this is just the way things are, people who want to change and heal the world? It means instead of asking, how do we fix this? We ask, how do we reframe this? Because when enough of us dare to turn the lens, shift our perspective, and co-create these new patterns of possibility, the kaleidoscope no longer remains with one survivor. It becomes collective. So we have to internally reflect and ask ourselves, what can I do? How can I, as a single person, lead change? Because being a change maker isn't about age or titles or waiting for permission. Being a change maker is about choosing to see a problem and choosing to act. It's about using your voice, your skills, and your passion to create change, no matter how daunting the odds. As change makers, we're not bound by the way things once were. We must be and can be dreamers, doers, and disruptors. We need to reimagine systems, challenge norms, question the status quo, and build a world where access is a right and not a privilege. Imagine a world where survivors are not silenced, where trauma is not taboo, where climate policy is not just science but equity, where those who have known brokenness lead the way in reimagining systems of care, compassion, and justice. That world is not a fantasy. It's just a prescription waiting to be filled. I became a change maker because I didn't want anybody to feel as broken as I once had. And I refused to accept that this is just the way things are. And my change started small until it reached the global stage. I am still healing, turn by turn. And every time I help someone see the beauty in their brokenness, I heal a little more. So know this, if my kaleidoscope can make possibility visible, then so can yours. You don't have to wait for the picture to be perfect. The pieces don't change. You do. Know that you don't have to change the world in one grand gesture. It's enough sometimes to just shift your perspective, to see, love, and share these new possibilities with others. Know that each time you shift your perspective, you will unlock new patterns of hope and healing, not just for yourself, but for anyone who has ever felt broken or invisible. Your courage, your resilience, your passion can become visibility. So now that you have your own kaleidoscope, what change are you going to create first? Thank you.